biggest question I tend to get from parents about diagnostic process with their children, if they're looking at ADHD or other possibilities, is what to expect from an evaluation. How is it conducted? And it's important to know that there's not a single test or diagnostic procedure that answers that question, nor are there symptom checklists alone or behavioral rating forms filled out by parents or teachers alone. None of those are sufficient to make a diagnosis. What happens in a comprehensive evaluation is that the heart of it is a thorough clinical interview with the child and parents, reviewing details about the problem areas that are being seen, also assessing the child's strengths and interests, and a thorough review of history, social functioning, academic functioning, family functioning, and so on. An evaluation for ADD may include one-on-one testing with the child or behavior rating forms filled out by teachers or parents, but those items are not necessary. They can be helpful, but they're not sufficient. And then finally, in the end, I find that parents, the real question is, what accounts for what's going on with my child? Is it an attention disorder or not? And comprehensive evaluation is really designed to answer that broader question, not simply yes or no, it's an attention issue, but what's going on to account for what we're seeing. Particularly if it's not an attention disorder, there are many conditions that create symptoms that get mistaken for ADD, and a process of entertaining and ruling out other options is necessary in that comprehensive evaluation process. And secondly, sometimes there is ADHD and other things going along with it that are important to consider in terms of understanding what's needed for treatment. So in the end, a comprehensive evaluation is very practical, and that is it leads you to what are the steps, what are the interventions, strategies, supports that are going to be appropriate to help my child down the path, the right path. By the end of a comprehensive evaluation, that kind of information should be shared in detail so that decisions can be made about how to move forward. And then finally, who can diagnose ADHD? Physicians are able to do that, as are mental health professionals, depending on their training. So the more comprehensive or practiced someone is at doing that, the more skilled they are in helping you out.